Hey everyone, Dr. Shayna here. I'm gonna pop on here with the tongue therapist whose name is Ashley, I believe, and we're gonna talk about the microbiome, the oral microbiome, which gets so missed, and mouth breathing, and signs and symptoms of tongue dysfunction, and how can we help support that. Hopefully she'll be joining shortly. We're gonna be joined by the tongue therapist. In my experience, tongue ties, adult tongue ties, undiagnosed tongue ties, this little piece right under here, the frenulum, is hugely associated with things like sleep apnea and reflux, especially ones that are not touched by any kind of medications or herbs. I mean, sleep apnea, it's like usually there's a before and after. Like, oh my God, I got my thing. I got my CPAP and amazing things happened. There was Shayna before and Shayna after. I had a couple of patients in my private practice that there was not a before and after. There was, I still feel like I'm sleeping like shit and nothing's changing. And sure enough, he has had one of the worst posterior tongue ties I've seen. So I'm really excited to be talking to the tongue therapist about this because this is her area of expertise. In my area, I live in Montrose, Colorado. I have had the privilege of meeting a myofunctional therapist in Newcastle. Newcastle on I-70. Silt, I think it's Silt and then Newcastle. It's in the middle of fucking nowhere, basically is what I'm telling you. Hey, how's it going?
Hi, good. How are you?
I'm good. It's Ashley, right?
Yes, Ashley.
Awesome. Good to meet you.
Yes.
You go
Nice
by
to
the
actually
tongue
meet you.
therapist.
Yep.
Yes. Excellent.
Yeah. Yeah, I'm excited to talk with you and all of your followers. It's gonna be awesome.
Yeah. So I'd love to just hear a little bit how you got into the space, because I've met a couple of people recently in the last year or so that are into myofunctional therapy. And so it does seem like it's becoming like, oh, people are becoming more aware of the benefits of it. So I'm really curious how you got into it.
Yeah, for sure. So it definitely is something that's gaining a lot of popularity. So I actually came into it, well, my background is dental hygiene, but I actually have quite a few family members that are dental hygienists also, and that's one of the professions that can do myofunctional therapy. So it was actually my aunt that got into myofunctional therapy first, and
we are experiencing pretty significant, widespread thunder and lightning storms in Colorado, and I'm not sure where she's at, but she's in mountain time, so I wonder if she's been experiencing the same. Let's see here. Oh, technology is, you know how technology is.
hey, I don't know why it cut me out. It just booted me for some reason.
Oh, it's booting you again. Oh no, okay, I can hear you. Are you experiencing thunder and lightning storms? We are a little bit where I'm at.
I'm not. It's good weather where I'm at. It should be okay, but
Cool.
hopefully, fingers crossed. I don't know what that was. But anyways, it was my aunt that got into this field first, and when she started doing it, she came to me with it because she was like, you are who I was thinking of when I was going through like all of this training, like the mouth breathing, the dark eye circles, like the way that my face developed. And she started talking to me about all the stuff that she was learning, and it was kind of a similar experience that I feel like a lot of people who start learning about these things for the first time feel. I feel like I'm having my whole life explained to me. Like, this makes so much sense. And so from there, I knew that this was where I was going to go.
Yeah, and I always use the extreme example. I'm not sure if you watched Hey Arnold, but there was a guy on there who was just like the mouth breather, and he was so extreme. It was like,
yeah.
And like, I always use extreme examples because I never want my patients to feel like I'm making fun of them. So I give them like caricature, ridiculous things so that they can kind of see like the severe negative consequences. I would really be curious to hear your, because you've experienced mouth breathing, and I was allergy, asthma, huge problem as a kid, and then I learned about mouth breathing, I don't know, in college with meditations. Anyway, changing of facial structures when you start to nose breathe versus mouth breathe. Can you talk a little bit about that?
So yeah, I mean, mouth breathing completely alters the way that our face develops, especially when we're young. So when you are in your developmental years, if you're mouth breathing, it's going to change the way that your face develops, and it's going to cause more vertical growth, more narrow growth. And as an adult, if you've been mouth breathing up until that point, like I think a lot of people, like they see the, you know, the visual effects from it and they're like, oh man, I wish I could change that. And I never like to guarantee, like if you start nose breathing at this point, it's not going to change the way that your face develops. Like your face is formed, but there can be slight changes that are made. And posturally is the biggest thing. Like your face is going to look completely different if you're resting with, you know, balanced muscle use, your lips are staying closed, your tongue is staying up, your face is going to look different. So if I'm sitting here like this, slouched, and this is my appearance versus upright nose breathing, this is my appearance. Like you're still going to look better, but that facial, you know, structure change, I never like to guarantee. There's like a big social media trend of like mewing and like change the way that your face looks. And it's just, I don't fully buy into it. Like I buy into the health effects. Like that's what we're after, is the health effects, not changing the way that anybody's face looks. But that being said, like preventatively, like you can stop those like changes from continuing to happen over time if you start nose breathing. So you're not going to change the way that your face is now, but you're going to prevent like further narrowing and crowding of the teeth and that, you know, kind of lower hanging jaw. Like you're going to prevent those things in the future, but you're not going to change where your face is at now drastically. I mean, slight changes, but nothing drastic.
Slight changes.
Yeah.
So one of the things I'm really curious about is I have some friends, mostly it's friends, they kind of got like the tucked chin right here, and it's like their jawline isn't as defined. Is that something that you can see sort of shift? And I'm not saying like dramatic, you know, there's a lot of weird stuff that goes on on social media, and it's just like, really, people are totally buying into this. It's kind of crazy. I do think some facial work with craniosacral therapy could be really beneficial paired with myofunctional therapy. But again, we're not going to see like night and day differences, minus the fact that your skin is glowing and you look well slept.
So yeah, the jawline, it's definitely something that's affected. And a lot of people who have these issues have that like retrognathic jaw where it's more set back. And it can be changed a little bit. So if we're learning to rest with the jaw in the right position, I mean, when your mouth opens, it, you know, goes down and it goes back, so it sits back more. But also that weak jawline can also be from your tongue placement. If your tongue is sitting low in your mouth, all of this tissue is sitting down. So you can see the skin underneath the jaw more versus when your tongue is up. Now, something else, and I don't know if this is the case for everybody, but with my tongue tie, I felt like I always had tension back through here. And I felt like it was hard for me to have my jaw resting forward in order for my lips to seal all the way. And I do have a bit of an overjet, so my front top teeth go out over my bottom teeth quite a bit. And I noticed it pretty immediately when I had my tongue tie released, that it felt like it was easier for my jaw to rest more forward and for my lips to close. Like I felt like that release of that muscle and like that fascial tension that had been like pulling my jaw back. I don't think it's really visually different, but I can feel it.
Right. A relaxation. So one of the things, when someone told me, I asked them how their tongue rests in their mouth, they were like, oh yeah, it's kind of like tucked against the roof of my mouth. And I'm like, literally my tongue can't even do that. I was just like, what do you mean your tongue is relaxed and it's kind of like touching the roof of your mouth? Not like pressed heavily, but like resting there. I was like, wow, this is absolutely crazy. I've never heard of this. So I was like asking people when I was first exploring this TMJ dysfunction component, which everybody online says, oh, it's parasites. Is it parasites, or is a big part of it because a lot of us have an undiagnosed posterior tongue tie? Right?
And I mean, I think that there's a lot of things going into it, and that parasites, especially in like this naturopathic space, is something that I hear a lot too. And I think that, you know, as with a lot of things in the naturopathic space, like there's not a ton of studies on it. So I don't know completely like what the relationship is. I'm not saying that there's not a relationship there, but like it just makes so much more sense. Like your tongue function, like your tongue, when it is that light suction up on the roof of your mouth, that's stabilizing your jaw. That's what's holding your jaw stable so that these muscles don't have to work so hard. If your tongue, you know, can't function on its own, it's constantly needing these other muscles to work. And then if your, you know, tongue's getting into your airway while you're sleeping because it can't rest up on the roof of your mouth, now you're clenching and grinding. Like there's so many different ways that your tongue is contributing to TMJ that it's, for me, I'm like, it's just, it seems impossible to overlook.
Totally, totally. So it's now part of my physical exam on all of my new patients to look under their tongue and see what's going on, because if that's something we need to work through and like move towards if we're not improving. You know, one of the things that I always find really interesting is like there's a huge movement. I screen everybody for sleep apnea because okay, that can cause so many things. But the question is like you're not born deficient of a CPAP. So what is causing this? Okay, so one of the thoughts, I'm in high elevation Colorado, high elevation, that's a problem. Okay, I can buy that, but what else? Like that's not the only thing. People, what about people in Peru? They need CPAP significantly more than we do.
Yeah.
So I don't know.
Yeah, I think like the sleep apnea thing is huge, and to me, I mean, obviously I'm biased. I am the tongue therapist, so I'm looking at the tongue, but like you can see that the space that is the most narrow in most people's airways is that space behind the tongue. And when we have this epidemic of mouth breathing, so many people are mouth breathing, and it is just training everybody's tongues to rest low in their mouth. And when the tongue's resting low in the mouth, when you go to sleep and that all those muscles relax, the only place that it's going to go is backwards into that already narrow airway space. So it makes so much sense. There's obviously other, you know, contributors to sleep apnea. Like I'm not saying that the only reason somebody's going to have sleep apnea is because of, you know, tongue dysfunction or muscle dysfunction, but I think it's a huge part of it, and it makes sense with developmentally how we're developing for mouth breathing, and then the you know posture that our tongue's in when we're mouth breathing. And so many people today are, you know, whether it's from increased rates of allergies or the, you know, our modern day lifestyles, like so many people are mouth breathing.
Yeah. Mouth breathing is definitely something I wanted us to chat about pretty significantly because, let's see, I wonder if part of the reason we have so much allergies is because for a long time we thought the nose was ancillary, meaning worthless, just like the appendix, just like the gallbladder. You don't need it. It's just like extra garbage. Yeah. And I'm a believer that the body's infinitely wise, and there's a reason. The nose has 4 functions: to filter the air, to warm or cool the air, to moisten the air, and to slow the rate of the breath, which means you can take much bigger breaths that way. There's only so much air you can go in these tiny little nose holes at a single time, and they go through 3 of these like little windmill things. They're called turbinates on each side, so 6 total. And what is absolutely bonkers to me is one of the treatments for allergies is to remove all 6 of those turbinates, and I'm just like, oh my god. And somehow I'm a tinfoil hat wearer because I am a naturopathic doctor and don't think that that is what we need to be doing. I wonder if we started working on helping those kiddos and some of those who are now adults practice nose breathing, even though it's hard when it's stuffy, which is like an it's like, it's counterintuitive. Wait, you want me to breathe through my nose when it's stuffy in order to be able to breathe through my nose? Yes.
Exactly.
Let's talk about that.
Yeah. I think that's so true. I think that just modern medicine is they want the surgery, they want the quick fix. So it's like, oh, that's giving you a problem, let's just take it out. It's the same thing with like tonsils and adenoids in a way. Like it's so common, just take them out. You're starting to have problems, so they're not breathing good, just take them out. And you know, some kids do need their tonsils and adenoids removed. Like when they get so inflamed to a point where they can't breathe. But then it just, why are we not asking why? Like, why is their body responding in this way to where this child is suffocating because their tonsils and adenoids are so inflamed? Like, why are we not treating that instead of just, oh, if it's a problem, we take them out, and then that's that.
That's that.
Yeah.
What's crazier is they can grow back in some cases. What we're talking about here is the tonsils. When they get really swollen, say a kiddo gets strep throat all the time, there's something called I forget what the grade is, but it's like when they're +4, they're basically touching. They're so swollen, you can't even see the hole in the back of your throat. Like there's no hole. You just have your tonsils, and it makes it really, really hard to breathe. And then you add that to like an 8-year-old who has no freaking clue what's going on, and like super stressful for the parents. So I'm not demeaning that it's happening.
Yeah.
I'm just saying, why aren't we asking these questions like
exactly.
Ashley's saying? Why is this kid's immune system overreacting to this, relatively normal childhood illness?
Yeah.
That's a great question. Have you seen people's allergies improve or completely go away by incorporating nasal breathing into their daily life?
I don't want to say completely go away. I definitely think that allergies improve, and I think that a lot of what people see as allergies is the response to their mouth breathing. So regardless of whether you have allergies going on or not, if you breathe through your mouth, your nose is going to get more congested. And when you try to breathe through your nose again, it's going to feel stuffy and it's going to feel congested and uncomfortable to breathe through. Yeah. But you start breathing through it and that clears up. So a lot of people who do have allergies just get into this chronic cycle of mouth breathing. And then every time they try and switch off of mouth breathing, they're like, oh, it's too stuffy. So then they just keep on mouth breathing and the nose just stays congested. So if you can learn how to like control that through breathing techniques, learn how to breathe through the air hunger, like you can control those allergies and that congestion and keep it at a point where you can maintain nose breathing even when the allergies start to creep in. And so you start to feel that congestion, you keep breathing through it, and so you don't feel the effects of it as much.
Totally. One of the things I try to, or the way I explain it to some of my people is we've got muscles in our sinuses, and usually this is the main sinus that people are having impacted, and like, oh, I just can't breathe, my nose is too stuffy. Well, when you don't breathe through your nose, you're not creating nitric oxide, which all of men with erectile dysfunction know about nitric oxide because they take Cialis and Viagra, and that actually, we have the same erectile tissue in our nose as we do in our genitals. Yeah. So it's really interesting. You take Viagra, you get a stuffy nose because it's the same tissue. So the more that we can breathe through our nose, we strengthen these muscles so that they can do their job. And I'm like condensing it a little bit, but it kind of seems to work for a person that doesn't really understand anatomy. And that nitric oxide is so important. I wonder, I have seen some interesting stuff doing biofeedback with some of my patients when I was a student. Blood pressure, medication resistant, high blood pressure issues. We get them breathing through their nose. They were required to come once a week for an hour for 8 weeks. One guy, he was on 3 medications. This was kind of his last hurrah before, he was just giving up hope. And his blood pressure started to gradually come down. And he was able to come off some of his medications. He didn't even stay on one of them. Yeah. But to stabilize his blood pressure compared to just like, there was one day he came in, it was like 210 over 110. And he was like, yeah, I don't feel any symptoms at all because he got used to it. Yeah. Which is crazy. Big mouth breather. Super stressed person, and I think a lot of us, when we get stressed out, like I am feeling a little bit excited right now, we chest breathe instead of belly breathe, those deep breaths from our diaphragm, which also impact our circulation of our breath.
Yeah. Yeah. I think that a lot of that, number one, I've heard like nitric oxide can help with like vasodilation to, that can impact it. But also, I think that people don't realize how much mouth breathing is keeping them in their fight or flight nervous system. Like they are staying in their sympathetic nervous system all day long when they're mouth breathing. It's like this like low grade chronic hyperventilation. Yeah. And so it's like no wonder like you constantly feel stressed and you constantly feel anxious and you have high blood pressure. Like your body is in like fight or flight survival mode all day long. Like even when you're not doing anything, even when you're just, sitting at home, you're sitting there mouth breathing, almost hyperventilating, like keeping yourself in this stressed state all the time. And it impacts your quality of life so much. And until you kind of pinpoint, like I can kind of control that. Like I can reel that back in just by the way that I'm breathing. Like kind of like you said, like I have days at work where it's like you get super flustered, like I'm, running around with my head cut off and I'm like, I feel terrible. And then all of a sudden I'm like, oh, wait, I'm chest breathing. I'm shallow breathing. Like I'm barely, Like I'm not using my diaphragm. And the second that you start breathing, like you can feel it pretty immediately.
Mm-hmm. Totally. And
it self-regulate.
Mm-hmm. I wanted to talk about the oral microbiome as well. I've had people argue with me on social media, which I just let them go or block them. They're like, my mouth has nothing to do with the fact I have reflux. Really? This is the step one of our digestive system. Actually, it starts in the brain, but it starts with chewing our food. And I'll often say that our stomach doesn't have teeth, so then we eat mindlessly while we're driving to work or sit in front of the TV. We're not chewing our food, so then our stomach has to work even harder to digest our dang food. And this mouth breathing impacts our oral microbiome, and the fact that we live in a rush, fast-paced society too. Let's talk about the oral microbiome for me.
Okay, so what we're talking about with the oral microbiome, it's the balance of pretty much good and bad bacteria that you have in your mouth. So your mouth is going to be covered in bacteria one way or another. Ideally, you want those bacteria to be more of the good bacteria, less of the bad. But there's going to be bacteria there, and that's your microbiome. And when you're mouth breathing, you're breathing in all of those pathogens in the air that normally would be being filtered out by the nose. Now you're breathing those right into your mouth. So you're introducing more harmful bacteria that way. You're also drying the mouth out. So that's altering the environment, and it's like giving an environment where more of the bad bacteria can thrive. And then we have, the issues with oral function. Like if we're tongue-tied, and that's why we're mouth breathing, now our tongue can't clear food as well. Now we're not chewing as well. And so a lot of times those people have like higher plaque levels. They're not chewing their food thoroughly. They're getting pieces of food caught where their tongue can't clear it out. And so now we're having this like carbohydrate rich, acidic environment that's also dry, has more harmful bacteria in it. So there's a lot of ways that our microbiome is altered by this issue of oral function, mouth breathing, tongue ties. And that communicates directly with your gut, because everything that goes into your mouth, you have all those bad bacteria. Now that's the hole that you're eating through. So as you're chewing, those bacteria are coating it and you're swallowing it, and that is going straight into your gut. So your gut microbiome, which is like a huge topic, I feel like everybody recognizes the importance of the gut microbiome. And they just completely disregard the oral microbiome, which they're like so closely intertwined that it makes no sense. You have to have a healthy oral microbiome to keep your gut microbiome healthy, because all of those bacteria are just going to be transferred right to your gut anyways.
We talk about digestion from north to south. So we start in the mouth and move down to see how we can figure out how to adjust it. Especially, I work with a lot of upper GI stuff, so mouth is a big part of it. When I was in school, I took a class from a biological dentist, and one of the tenets of naturopathic medicine is treat the whole person. And he joked, except the mouth. We had 0 classes on dentistry, and I don't want to be a dentist. Like, I'm not a dentist, I'm not a dental hygienist, but it is part of the digestive system, and we just don't even talk anything at all about it, which is so shocking to me. And that class, there was only he taught it for 1 quarter a year, and there was maybe like 15 of us, and that's it. 15 of my class of 80 classmates that were weren't even interested in like learning anything about the mouth, which, that's part of I've got a history with mouth issues, so like I'm curious to see what's going on. And
it really is kind of funny how dentistry, it's seen as like not medical.
Right.
Like it's part of the body, but it's not medical. Like it's like, I don't know what they view it as, but it's like it's completely set off from the medical field. And I think hopefully in the future, like it'll be more intertwined, and we have all these amazing like complexes where you can go and have like all of your different medical providers and see all of these different modalities. Dentistry is never involved, but we're finding more and more. I know we're not here to necessarily talk about dentistry, but just your dental health in general, it's so intertwined. Like if you're looking at periodontal disease, caries, like it impacts your whole body health. It's not a mouth issue. Like if you think about it, if you're mouth breathing, you're inhaling. So you're inhaling those bacteria, you're inhaling, those pathogens that you're letting live in your mouth, and then you're swallowing them. And then when you have periodontal disease, and your gums are bleeding, all of those blood vessels are opened up and you're letting those pathogens straight into your bloodstream. So it's like, it makes so much sense that oral disease is so connected to all of these other, every other part of the body, but we just isolate it. And we only treat the mouth and we don't treat it as part of the rest of the body.
Not at all. And there's a couple dentists I follow on social media, and you know, I have a patient that had a root canal done, and she was experiencing new onset hyperthyroid, and she was able to kind of help. The teeth issues seem to be playing a role in that, and it manifests in different people different ways. Often there is a cardiovascular component that shows up when we have mouth issues, and it impacts the cardiovascular system, especially periodontal disease. And man, I tell you, like, I hope for the medical homes that are inclusive of all the different practitioners, because there are things that are not my strong suit that a medical doctor is much more astute at, and vice versa. Like, if I get in a car accident, not going to take me to an ND's office. You're going to take me to the hospital, and they're going to fix my bones, and then I'm going to go to an ND afterwards and help the healing process and the pain get alleviated without having to jump down a whole bunch of medications. There's a time and a place for all forms of medicine, and the fact that we kind of shunt different practitioners, and you know, there's not many people that do what you do. I think there's 2 on the western slope here in Colorado, and one lady I think is about to retire, and the other person, she's like newer into the field. She's only been a dentist for 7 years, and she hired this person, and she's really on board. But it's hard to make that shift when not enough people are aware of the consequences of mouth breathing and how that impacts our microbiome, our sleep. And I mean, everything is worse when you don't get a good night's sleep. Just ask a new parent.
And I mean, one of my favorite things is like when you look at on, you know, daylight savings time, when people lose an hour of sleep, and this, like, you just see the like number of like health emergencies that day skyrocket. And it's like, that's 1 hour of sleep. Imagine the people who are getting terrible quality of sleep night after night, and they just survive that way. Like, that's they're not thriving. They literally are just surviving. And I think especially, sometimes I like hesitate to be like, oh, especially for women, because men are absolutely affected by sleep apnea, 100%. Like, they are predominantly, like, the sleep apnea demographic is men, but that also makes it hard for women, because women experience a lot of sleep disordered breathing and a lot of really poor sleep quality that doesn't qualify as sleep apnea. So they don't get any help. It's just not recognized that there's an issue there. And so there's so many women that, you know, are looking for answers, and they're going and getting sleep studies, and they're doing, you know, all of these things. And it's just like, well, you don't have sleep apnea, so we're good to go. You're fine.
Isn't that interesting? There's a lot of things in the medical world that just don't pay attention to, that there are some different needs of the male and female anatomy, and things show up differently. Like heart attacks in women generally show up a little bit differently than men. Like, it's not usually like the pain down the left shoulder. And actually, one of the stories I learned in one of my diagnosis classes when I was in school, teacher who's an ND was an EMT back when he had this happen. Little old lady, she was totally, her demeanor was totally fine. She just had this really awful toothache. That's the only symptom she had. She had no pain. She was just like, you know, just my tooth is really bothering me, and I'm just feeling like something's not right here. Sure enough, she was having a heart attack, and like, her tooth is fine. She was just having a heart attack. Like, and we miss things because we're not paying attention to we're looking for like, oh, the pain down the arm, and like the pain in the back, and I'm having a hard time breathing, and we miss these things. So for people that are at home, we've talked a little bit about some of the signs and symptoms. It sounds like tongue, where the resting position is. Obviously, if you have TMJ dysfunction, that's a big one that could be tongue issues. What else are things that people could look for so they can start self-identifying? And I'm always like, always work with a practitioner that knows what's up. Like, I say this in every video because people get really wound up. They look for advice online. Work with a professional. Professionals know what's going on. Please and thank you.
Love it. Yes, absolutely. Like, definitely don't self-diagnose. Like, you can look for the warning signs. That's why, you know, if you follow my page or if you look at my page, that's what my page is all about. I'm trying to get the information out there so people know what to look for, but it's not so that you can self-treat or self-diagnose. It's so that you can recognize those signs. So Number one, tongue posture. So let me explain what correct tongue posture actually is, because a lot of times, we just kind of simplify it and we're like, tongue on the roof of the mouth, and people will kind of pay attention and they're like, yeah, I think I'm doing that. And then the more you start to talk to them, about it, you're like, okay, that's not what we're looking for. So when your tongue is on the roof of your mouth, the tip of your tongue should be slightly behind your front teeth on the top. And the back of your tongue should be lifted up and suctioned to the roof of your mouth. So this is where you were talking about earlier, like it's just lightly resting up there. It's not pressing up there. We get this suction, and then the tongue just it just chills. It stays sealed to the roof of the mouth, and that's where it can really rest up there. When the tongue is pressing to the roof of the mouth, that's where, when we go to sleep, it's most likely going to relax and it's going to come down. That pressing isn't going to keep happening when you go to sleep. That pressing is also kind of creating like a backwards force. If you're pushing up, what's your jaw going to be wanting to do? It's going to want to push down a little bit.
Right.
And so that's now these muscles are having to stay over engaged. So we definitely, we want that suction. We want the whole tongue up there, and we want it suctioned to the roof of the mouth. Number one, you can look at orthodontic issues. I think this is a big warning sign for a lot of people, is they're like, hold on, I needed braces for 3 years when I was a kid, and I needed a palate expander. You've got some oral function issues going on. If you had braces and your teeth shifted again, you've got some oral function issues going on, because your facial muscles are the natural retainers of your teeth. That's what determines where your teeth want to rest. So if you had braces and everything's crowding again, that's a clear warning sign that your tongue is down in your mouth, or that it's pushing against the teeth. It's doing something that it's not supposed to be doing. And then the mouth breathing, obviously we talked about. The digestive issues can a lot of times be a warning sign. A lot of times people with these issues, like we talked about, they're not chewing well. They're not swallowing correctly. So they're swallowing with the tongue thrust, and they're gulping, and they're swallowing kind of lots of air as they swallow, and they end up with bloating and reflux and digestive issues. So those can be warning signs. There's a lot of different things that go into it. If I know I'm missing some, but look at my page, because I post them all the time. So whatever I'm forgetting, you'll find it on there.
Yeah, and I'll make sure to link her Instagram, because it's a really helpful resource. And we had one question I thought was worth chatting about, and it's a gentleman says, doing a tongue tie surgery before a maxillary expansion in a patient with a narrow maxilla, can this increase sleep disordered breathing? That is out of my scope. Have you ever heard of tongue tie release causing issues with more sleep issues?
Yes. So, I mean, everybody's situation is different. And this is kind of what we were talking about. Like, people want like one clear presentation of like, this is the problem, this is the exact solution. And it's just not the way that it works. Everybody's situation is different. So there's like a big debate. Like, a lot of times people who have these issues, have tongue ties, are also people that would benefit from, palatal expansion, and a lot of times that's surgery. And there's a debate of, okay, should we release the tongue tie first, or should we do expansion first?
I see.
And I'm not going to give an opinion on that, because it can go either way, and it's up to your providers. Different doctors are going to have different opinions, and it depends on how narrow you are. How severe is your tongue tie? How much space do you have behind your tongue and your airway? But there is risk, especially if you're not doing therapy beforehand, that if you release a tongue tie and you weren't ready for it, we didn't do therapy beforehand, and your tongue doesn't have the space that it needs in your mouth, now you have more of your tongue that's free to move when you relax while you sleep. So if we didn't correct your tongue posture, and we don't have space for your tongue to rest on the roof of your mouth, now you have more of your tongue that can block your airway. So it can worsen sleep issues in some situations. But that's if you're not doing the proper like preoperative work. If you're going through the therapy and, having those checks, then releasing the tongue tie shouldn't worsen like sleep apnea or other sleep issues.
Right. So basically what I'm hearing is it depends, just like most things in medicine.
Exactly.
And if you don't do the physical therapy, which tongue therapy, myofunctional therapy is physical therapy for your tongue, you are going to have problems. And I know some of my moms that have had pediatric tongue ties cut, like if they don't do them properly, they're just going to go right back. It'll grow back. You got to stick your finger under there and like keep that from sealing back. The body likes consistency, and if it knows something, sorry, I'm talking fast. Thank you for letting me know.
I think I
if it
fast
knows
as well.
something, it will go right back there if you're not properly adjusting the posture.
Yeah.
And you break your ankle, you go through surgery, you just leave it in the cast and call it good? No. You have to do the proper therapy in order to reap the benefits and have that change in fascial function. And fascia, the way I kind of talk about it, is like the sausage casing, and it's like this really intimate network of nerves and blood vessels that communicate. It's actually a really cool system if you want to nerd out and look into it. The fascial system gets all tight around things. And so when we're undoing, that's why body work, things like massage, craniosacral therapy, myofunctional therapy, physical therapy, help to break up that fascia so that it can create new pathways of being able to move in the body.
Yeah. And I think that somebody, I saw one of the comments said, like, people are jumping to releases too soon. And I think that's very true, because I mean, it's a human nature thing. People want an answer, and they want an answer that's going to be fast. And so I think a lot of times people go into this, and I'll have people reach out to me that they reach out and they're like, I want to get my tongue tie released, but they say I need myofunctional therapy. So like, let's get this going. Like, let's do therapy, get my tongue tie released. And I'm like, it's just not what I'm about. We're going to treat the whole issue. I'm not just going to get you ready for a tongue tie release as fast as I can. Like, we want to treat this from the ground up and treat everything. And I think a lot of times, like, people just they're like, what's going to get me the best or the most results the fastest? And so they just want that. They want that release because it's, it's going to be great. That's what's going to solve their problems. But so many of your problems are just a deeper level than that. Like, you need to, from the ground up, change your habits. Like, I'll say my own personal situation. I waited over a year and a half, almost 2 years, to have my tongue tie released. It was a fairly severe tongue tie. And, I could have had it done earlier, but by the time I, had it released, I was already nose breathing. I was already having correct tongue posture. I was already swallowing correctly. Like, so much can be done through therapy and other modalities before you just jump to the quick fix surgery. And then when I had the release, it's just icing on top. Like, now I'm full, now I'm getting myself fully there. Now I have that release of that tension that we were talking about. But it's not the
you were ready
solution.
for it, though. That's the important thing.
Yeah.
Your system was already, the fascia was already released, and that was exactly like you're saying, the icing on the cake. It's like, oh, my tongue can finally move appropriately. One more question, and then I think we should wrap up. The same gentleman asks, what do you think about myospots for helping with tongue posture? I'm not sure what that is either.
Yeah, so myospots, it's essentially a little kind of material that roof of your mouth on the spot. So the spot is that little bump behind the two front teeth, the retroincisive papilla. That's where the tongue goes. So people use this little spot that they dry the roof of their mouth, stick it up there, and it's kind of like a tongue trainer to help the tip of the tongue recognize that's where it's supposed to sit.
I see.
So it's a helpful tool, but again, kind of like I was saying, the only goal of therapy isn't just to get the tip of the tongue to the spot. So it's a great tool to help the tip of the tongue recognize that's where it's supposed to go. But now we need to make sure that the rest of the tongue is up there and it's suctioned and sealing the way that it's supposed to. We still need to make sure that the tongue is able to function on its own without other muscles, that we're able to create the correct swallow motion, like all of these other things that aren't going to be solved by just a myospot. So helpful tool, not a solution.
Helpful tool. Got it. There's a lot of tools. It sounds like but things need to be done in the appropriate manner for you and what's going on for your individual needs. And I'm sure you have never seen a single person that looks exactly like all your other patients. Yeah. Everybody's going to be intimately a snowflake, and I say that without any derogatoriness. It's like, we have special biochemistry. We're all a little bit different. We're all a melting pot of ethnicities. This affects our bone structure, the way we were raised. I don't know, if you were raised in a stressful environment, maybe that teeth clenching kept you safe in some way, right?
Yeah.
Anyway.
There's a lot that goes into it. Nobody's the same. Even if you have all of the same structure, like you can have somebody with just as a severe looking tongue tie that's going to have completely different symptoms, completely different presentation. So it's never going to be like cookie cutter by the book. You're not just going to follow a one-step process to get you there.
Nope. And if you find a therapist and a dentist that say that that's how it is, you need to find a different one, because that's not how it is in naturopathic medicine, and that is not how it is in oral health care either. I would say really anything. Like a good surgeon knows that, like, oh, we're going to approach this break a little bit differently, even though it's still the same kind of break that he specializes in. You see what I'm saying? Like, you really want someone that's going to understand and listen to your body, the symptoms that you're experiencing, and then create a treatment plan that's appropriate for you, which is why DIYing it never works fully.
Yeah, 100%.
I really appreciate you taking the time out of your day, Ashley, to chat with me and help people gain more awareness around this really important thing. What's the best way for people to get in contact with you if they're interested in a consult?
So you're already on Instagram, just go over to my page. There's links in my bio to set up. I do free 15-minute consults to talk about your situation, see if like you're heading in the right direction, if myofunctional therapy might be a good fit for you. So I just head over to my page and use the links in my bio.
Awesome. Well, thank you so much. And I hope you have a great rest of your day.
Yeah, you too. Thanks.